Hello, and welcome to the CMS National Training Program podcast, brought to you by the Centers for Medicare and Medicaid Services, or CMS. We're here to help our partners and the public better understand CMS programs. The information in this podcast is not legal guidance or intended for press purposes. Official Medicare program legal guidance can be found in the relevant statutes, regulations, and rulings. With that said, I am your host, Michaela Wright. From time to time, CMS gets questions about various topics, and today we'll answer a few of those questions with the help of Daniel Simmons, our Medicare specialist. Great having you again, Daniel.
Great to be here, Michaela.
Today we're talking about Medicare Advantage prescription drug coverage. We'll take a look at some questions we've received and how to approach them.
Okay, what's the first question?
A few people said their Medicare Advantage, or MA plan, doesn't cover their medication as they expected it would.
Well, some MA plans include prescription drug coverage, also known as Medicare Part D. If you choose one of those plans and aren't able to get your medication, here are some possible reasons why. First, it could be that your enrollment isn't effective yet, or you were disenrolled from your plan without knowing it. This can happen for a variety of reasons.
What's an example?
Say the plan didn't get your recent premium payments because of a billing error like an incorrect address or bank account number. If that happens, the plan can disenroll you if you don't respond to their notifications, and the pharmacy won't be able to process your prescription because you don't have coverage.
Okay, what else?
A second possible reason, plans often have requirements in place for certain medications.
What kind of requirements?
For example, prior authorization from the plan, step therapy requirements, or quantity limits. If these requirements aren't met, the pharmacy won't process the prescription.
What should people do in that case?
The plan, your doctor, and the pharmacy will often work together to resolve these situations, and in some cases, your doctor may adjust or change your prescription.
Great. Any exceptions?
Sometimes you may not be able to access medication for safety reasons, like for opioids in certain situations. Your plan's drug management program has rules about how and when you can access your opioid prescription.
I see. What's another reason why you might not be able to get your medication?
Here's a third possibility. Every plan has a list of drugs they'll cover, which is called a formulary. Plans are allowed to make changes to their formulary, so a medication may be covered one year, but not the next. If plans make any changes, they're required to notify you.
Perfect. That's good information.
And if any of these situations come up, contact your plan. The same goes for many of the other situations covered in this podcast. If the plan is unable to assist you, contact 1-800-MEDICARE or your local state health insurance assistance program, also known as your SHIP office.
Okay, on to our next question. My prescription drug costs are higher than I expected. Why would that be?
It could be a couple of things. The plan may have placed the drug on a higher tier in its formulary. If that happens, you'll have higher out-of-pocket costs.
Are the plans required to notify you when they make these types of changes?
They are, but if you don't remember the change was happening or didn't see the notice showing the change, the extra cost can be surprising. You may be able to ask the plan for a tier exception.
Good point. Anything else?
Another possible explanation is if you get assistance for your medications through a state program, but that assistance stops, your out-of-pocket costs can go up.
That's good to know. Well, thank you, Daniel, for helping us better understand how Medicare Advantage prescription drug plans work.
Absolutely.
That concludes this episode of the CMS National Training Program podcast. Thanks for listening. You can find out more about Medicare prescription drug coverage at medicare.gov. Just click on the Drug Coverage Part D tab at the top of the page and visit the CMS National Training Program website for more training opportunities and resources. Until next time, stay healthy and stay informed.